Hello folks, welcome to RN NCLEX Dex, and this is the corner where we study for NCLEX and we give you some nice little tips on how to study and get prepared for your NCLEX, and we talk about all things nursing. So today we're going to talk about the top 10 high yield meds for NCLEX. These are must know medications with their side effects. Pharmacology does not have to be overwhelming. So if you know these top 10 meds and their must know side effects, you'll cover a huge portion of your NCLEX. Quick promise. I want to make you a quick promise that if you stick to the end, I'll share an easy mnemonic. If you stick to the end, I'll share an easy mnemonic for you to remember. So the first medication that we're going to look at are the beta blockers. So these are beta blockers. Right, and these medications usually have the suffix lol. So they have lol as their, that means lol is at the end of all these medications. So for example, we have atenolol, we have propranolol, and metoprolol. I'm just gonna give you a few. So you will realize that at the end of these medications, you have lol, and that is the suffix. So let me write that here. This is the suffix. So they always end with lol. So these medications are used primarily, are most commonly for conditions such as hypertension, angina, and what else? Can you tell me any other? We have arrhythmia. Right? So these are the most common types of conditions that they are used for. So what are the side effects? Some of the side effects that we may have from these medications are bradycardia. And bradycardia is when the heart rate is beating slower than normal. So bradycardia may be any heart rate that is like under 60. Let me correct that. Yeah, bradycardia. So if the heart rate is under 60, it will be termed as bradycardia. That means the heart is beating much slower than it should. You also have bronchospasm. And in cases of bronchospasm, you may not want to give this type of medications to persons with asthma, because this can cause complications in persons with asthma. You know, it can constrict the airway and all of those stuff. So you avoid these medications if the person has asthma. What else are the most common side effects? Hypotension. Yes, hypotension means that it can drop the blood pressure. It can drop the blood pressure. Just ignore my spelling error here. Right? So it can cause hypertension. So you may realize that the most important thing that these medications affect in the body are the blood pressure, the heart rate, and it can also cause bronchospasm. So what is the NCLEX tip that I'm going to give you? What's the next NCLEX tip I'm going to give you? Is that when giving these medications, always check the heart rate and the blood pressure before giving. Right? So before you give it, get your monitors and do your vitals on your patients. All right, so that's all we need to know about beta blockers. So we're gonna move on now to number 2. And what is number 2? Number 2, we're gonna deal with the ACE inhibitors. These are the ACE inhibitors. So the ACE in ACE inhibitors means angiotensin converting enzyme, right? So these medications, can you list any of them? Do you know any of them? One of them is lisinopril. So you may realize that the suffix for these medications, they're called prils. They end in pril. Pril. Right? So lisinopril, enalapril, and captopril. So I'm just listing a few here, a few of the common ones. Lisinopril, enalapril, and captopril, and these are used mainly for hypertension, and heart failure. These are the most common uses or indications for them. And what are the side effects? Can anyone tell me the side effects? The side effects for these medications. So the side effects are dry cough. So you'll find that people who take these medication, they can cough sometimes. And sometimes when people take this medication and they're coughing a lot, sometimes the doctors may take them off and put them on some other medications, but we'll get to that later. Right? So dry cough is one of them. Hyperkalemia. Hyperkalemia is high potassium in the blood. And angioedema. So angioedema is swelling of the tongue. So you may realize that some persons are allergic to these medications and may be prone to angioedema. Okay, so as I said before, if some persons develop some of these symptoms, the doctors may take them off and use a different substitute that does the same work, may use another substitute that does the same work as the enalapril, the captopril, or the lisinopril. And so we're going to move on to that next. But before I move on to that next, your NCLEX tip for these, your NCLEX tip is what I've been explaining to you. and that is if cough develops, we're going to switch the patient to another medication. Does anybody know what that medication is likely to be? So you're going to switch to, does anybody know? Well, it's ARBs. And so because we're talking about ARB, we're going to move on now to the ARBs. So number 3 is the ARBs. So ARBs means angiotensin receptor blockers. Angiotensin 2, that is. Receptor blockers. And what these medications do, it prevents angiotensin 1 in the blood from being converted to angiotensin 2. And in doing so, it prevents vasoconstriction of the blood vessels. So it's, in other words, when it prevents vasoconstriction of the blood vessels, it's causing the blood vessels to dilate so that the blood pressure can go down, right? So once there's constriction, the blood pressure is likely to go up. But once there's dilation of the blood vessels, the blood pressure will go down. So that is the effect of the ARBs. It prevents the enzyme angiotensin 1 from being converted to angiotensin 2. Because once it converts to angiotensin 2, it means vasoconstriction is going to take place, and we don't want that. We want the blood vessels to be dilated. And that is what AC inhibitors does as well. But as I said before, if the coughs develop or if angioedema develops, you switch the patient to the ARBs, and that is what we're talking about now, the ARBs. The ARBs, does anyone know the suffix for the ARBs? The suffix is sartan. That means these medications usually end with sartan at the end of the name. And these are also used for high blood pressure and heart failure. So I'm going to put HTN here and HF. HTN for hypertension, HF for heart failure. Right? So the side effects, for these medications are hyperkalemia. It causes high potassium in the blood. Right, hyperkalemia. Also, it can cause dizziness. Remember, once the blood pressure drops, the blood flow is settling in the body, and so the person may experience dizziness. And so you have to be careful, or you have to tell your patient to be careful while walking around or while getting up from a lying position to a standing position, because dizziness can occur. So these medications are the safer options if the patient is unable to tolerate the ACE inhibitors. All right. All right, so number 4 is these medications are the calcium channel blockers, and they are, some examples are amlodipine, diltiazem, verapamil, right? So they are usually used for hypertension, arrhythmias, and angina. And you may see that some of the side effects are they can cause hypertension, they can cause edema, and they can cause constipation. The verapamil usually causes the constipation here. It's the most common one that causes a constipation. So your NCLEX tip is to monitor the blood pressure and the heart rate. Why? Because it has the ability to drop the blood pressure, and it also has the ability to slow the heart rate down. Yes, calcium channel blockers can reduce the heart rate as well. Right, so if the patient has a heart rate in the 40s and all of those stuff, you may want to reconsider giving it to the patient, because it's going to further drop the heart rate. Right, so these are things to take into consideration. Also, you may have to teach the patient to avoid consuming grapefruit juice while taking these kinds of medications. All right. Okay, so the next one is Digoxin. And this one, it's used for heart failure and atrial fibrillation. And you may see the side effects for using Digoxin is Digoxin toxicity. And so you have to know what are the signs of Digoxin toxicity when using Digoxin. Some of the signs include vision changes. Let me see if I can put them here. Vision changes with your vision, and the person may be seeing like yellow halos and seeing some yellow halo lights in their vision. So you know that is one sign. Also, the patient may have nausea. They may feel sick and want to throw up. And also confusion is one of the other signs. Right? Other signs of digoxin toxicity also, well, it's not a sign of digoxin toxicity, but it's one of the signs of digoxin, and that is bradycardia. So you may realize that the function of digoxin is to increase the contractility of the heart and slows down the heart rate, right? So the person may experience bradycardia in using digoxin. So these here are the signs of digoxin toxicity, which is one of the side effects of digoxin, and another sign of digoxin is bradycardia. NCLEX tip is that you're going to always check your apical pulse before giving digoxin, and if the pulse is less than 60 beats per minute, you will have to hold this medication, right? Because it means that if you give this medication while the pulse is less than 60, it's gonna cause problems. So we would want to hold that. So at number 6, we have insulin, and we have different types of insulin. So we have the rapid acting, short acting, intermediate acting, and long acting insulins. And what we want to know about insulins is that we must know the onset of each insulin, the peak, and the duration, because these are going to be important in terms of knowing when the patient is at the peak point after in administration, and when the duration for these insulins are complete. So the side effects for the insulin, the most common ones are hypoglycemia, lipodystrophy, right? And the NCLEX tip that we want for the insulin, we want to give for the insulin is give the rapid with meals. The rapid are always given with meals because once these are given, the blood sugar level is going to drop really fast, right? So what you also should know is that know which insulin you can mix. For example, the regular is mixed with the NPH, right? So don't worry, you'll get more explanation on these. There will be resources for you where you can get into detail with these things. But we just want to go get a quick run of these medications that you need to know for NCLEX, all right? So we have the anticoagulants, and examples of these are heparin and warfarin. So for heparin, we usually do lab tests to monitor the PTT levels, right? These are very important. And for anybody who has used heparin before, usually you have to know what is the antidote, right? Because if these levels go higher than they should, you have to know what the antidote is. So the antidote for heparin is usually protamine sulfate, right? Let me just write it here. And warfarin, you have to check the INR levels, right? And know what are the normal ranges for these. And the antidote for warfarin is vitamin K. So let me write it here. And the side effects for the anticoagulants are bleeding and bruising. So you have to teach your patients about the side effects and let them know that they can't, if they're brushing their teeth, they can't brush their teeth too harsh because they're prone to bleeding. They have to reduce needle sticks in these patients because it's easy for them to bleed. So you have to educate your patient on bleeding precautions, what to do to prevent bleeding and bruising, right? And the NCLEX tip that I want you to know is to avoid foods high in vitamin K if the person is on warfarin. And vitamin Ks are usually in green leafy vegetables. All right, so we're on number 8, and these are opioids. And the opioids, the most common ones are morphine, hydromorphone, and oxycodone. And the side effects that patients can experience are respiratory depression and constipation and sedation. So you want to look out for these side effects and educate your patient as well about these side effects. And the NCLEX tip that I want you to have in mind for these medications are to always assess the respiratory rate before giving it. And you have to hold it if the respiratory rate is less than 12, right? And if the patient is on these medication for quite a time, you may want to speak with your doctor to ensure that the patient, they're on some stool softeners to help prevent constipation, right? So that's all for the opioids. So the next set of drugs are the SSRIs, and these are the selective serotonin reuptake inhibitors. And examples of these are the fluoxetine, the sertraline, and the citalopram. And these are mainly used for depression and anxiety. So what are the side effects? The side effects may include sexual dysfunction, also weight changes, and risk of serotonin syndrome. This serotonin syndrome happens when the levels of serotonin in the blood is too high. So you might find that the patient may shiver, they may have diarrhea, they may have stiff muscles or what's called muscle rigidity, and they may also have fever and seizures, and these can last for up to 24 to 72 hours. So we have to be mindful of these. So we have to ensure that the patient does not stop taking these medications abruptly, because it takes weeks to start before they start working. And that is what I'm going to give for the NCLEX tip for these. These medication takes weeks before they start working. So encourage a patient to take them continuously and not take them abruptly and not stop them abruptly. So our number 10 set of drugs are the steroids, and examples of these are prednisone, hydrocortisone, and dexamethasone. And the side effects for these medications are immunosuppression. That means it can suppress your immune systems and make you prone to infection and other illnesses. So they tend to weaken your immune system. That is what it means by immunosuppression. Also, they can cause hyperglycemia. So usually when people are on these medications, the blood sugar levels are monitored, because the blood sugar levels tend to rise when patients are on these medications. Also, if the persons are on long-term steroids, they can cause osteoporosis. That means the bones can weaken and lose their calcification content. Also, persons tend to gain weight while they're on steroids, and they may also have mood swings, right? So the NCLEX tips that I want to give for steroids is never to stop these medications suddenly. These medications need to be tapered off. And you may ask why these medications have to be tapered off, and that's because once the person goes on steroids, the adrenal glands that usually secrete cortisol stops working once the person's on steroids. So if you stop taking the steroids abruptly, the adrenal glands do not start secreting the cortisol hormones immediately. So abruptly stopping the steroids can cause the person to experience adrenal insufficiency, because the glands in the body were not expecting you or the patient to come off these steroids so sudden. So why they are tapered off is that you continuously reduce the dose so that the adrenal glands can gradually release its own cortisone or its own hormones, right? So you have to bear that in mind. So we're at the end, but I promised you that I will give you a mnemonic by which you can remember these categories of medications. So let's go. Let's go. All right, so I'm going to give you an acronym, and that acronym is A, B, C, D, I, N, S, O, S, A, B, C, D in sauce. Can you remember that? Can you remember that? So let's write and remind ourselves what these mean, okay? So the A is for ACE inhibitors. So the A here is for ACE inhibitors. And the B, beta blockers. And what's the C? C is for calcium channel blockers. And what's the D? D is for digoxin. So that's that. We're gonna go in. IN for insulin. And N as in anticoagulants. N as in for anticoagulants. Anyways, all right, let me write it. I'm messing up my writing here. But let's go again. Right, anticoagulants. And the SOS in the acronym stands for steroids. And the O for opioids. And the S in SOS is for SSRIs. Sometimes you may see me making some errors in my writing because I'm writing too fast. But do you get the acronym now? Look at it. Let me go from the top of the paper. It's ABC in SOS. So A for ACE inhibitors, beta blockers, C for calcium channel blockers, digoxin, the D in digoxin, and then the IN, I in insulin, and N as in anticoagulants, and the SOS, S for steroids, O for opioids, and the S as in SSRIs. So if this video helped you, hit that subscribe button. I'll be breaking down every NCLEX system in simple, stress-free ways that you can understand. Comment which medication you struggle with most, and I'll cover it in a short video. So thanks for watching, and thanks for hanging out with me at the RN NCLEX desk. So see you in the next video.